When we're practicing video laryngoscopy, we want to keep in mind the type of device that we're using. There's two main categories of video laryngoscopes that you may see in the pre-hospital setting. One is a channeled device, and the other is an unchanneled device. Of the unchanneled devices, you may have a standard geometry blade or a hyperangulated geometry blade. Now, a standard geometry blade looks much like a Mac or Miller that you would use with direct laryngoscopy. This scale is the most similar to direct laryngoscopy for any of the different video devices. You can use a bougie or a standard ET tube with stylet if you're using a standard geometry blade. Now, if you're using a hyperangulated blade, like we see here, it's very important that you use a hyperangulated stylet. The geometry of the blade needs to match the geometry of the stylet to make sure that we can pass the tube without difficulty. So let's talk about each of these devices and demonstrate the technique for each device. So when using a hyperangulated blade, you want to have a light grip. So you're not using a lot of force when you're inserting this blade because you're looking around the corner of the mouth. You're not extending the tongue and the jaw to align a straight line of sight. So light grip here. And the way that I'm going to hold my stylet is an overhand thumbs up grip. This stylet is meant to be rocked back, much like a slot machine, and I want my thumb close to the thumb rest so that I can pop the top when I'm ready to advance it. So let's go through this technique. We're going to have a cadence of look down, look up, look down, look up. So I'm going to look down first in the mouth as I insert the blade. As soon as the blade goes around the corner of the tongue, I'm going to bring my gaze up to look up at the camera. I'm going to insert the tip of the blade into the vallecula and rock back just slightly. Note that I'm rocking back on my hand. I'm not rocking back or prying on the teeth. The idea here is I want a 50-50 view. So I want the vocal cords in the top half of the screen, and I want the rest of the oral pharynx in the bottom half of the screen. Now I'm going to look down to insert the ET tube. I want to come from the corner of the mouth, insert it. Once the balloon gets past the teeth, I'm going to start to rotate it midline. This is when I look up to the screen and I'm going to rock back. Notice this motion is a lot like a slot machine. As I rock back the ET tube, the tip goes through the vocal cords. This is the point where we can sometimes get hung up. So I want to pop the top. This will soften the tip, and I'm going to rotate to the right slightly as the ET tube goes down the trachea. Now my partner can pull the stylet down and away, and I'm ready to go. Let's go through video laryngoscopy with a channeled device. The important thing here is that we do not use a stylet, but you can use a bougie with this device. So instead of having a stylet, you have a channel that directs the blade to go anterior through the vocal cords. You'll want to do a little bit of lube on the top of this and definitely lube the tube a lot through the channel. I generally put the ET tube inside of the channel and I add a bougie so it's just behind the tip of the blade. This helps extend the view and place the tube a little bit more anterior. Notice this device has a little rest here, so when I remove the ET tube later, I have to make sure that I peel it out of that rest so that I don't dislodge the tube. So let's go through the technique with a channeled device. So we're going to start by looking down through the airway, inserting the device midline, and again, now we're going to look up to the camera. I'm going to look for the epiglottis, placing the tip in the vallecula, and rock back just like I did with my other device. Now I have my 50-50 view. You can see that my bougie is in the airway. Once the bougie goes through the vocal cords, the stylet, the tube goes right over the bougie. Now I can remove the bougie. And be careful, again, when you remove this device that you want to peel it out from the rest and then bring the device out carefully. Let's briefly talk about a standard geometry blade. Now, this is very similar to your usual intubation technique where you're inserting the blade, you're scooping the tongue, and you're sweeping over to the left, and then we're going to use a bougie. You could also use a standard stylet for this. So I'm going to look in the mouth as I scissor the teeth. I insert the device and I'm going to sweep the tongue up and out of the way. Now up on my screen I'll have a 50-50 view. And at this time I can take my bougie, insert it through the vocal cords, push it all the way to hold up. Then I take my ET tube, slide it in a little twist to the left, and then remove the device just like you would with any other direct